Most people believe dangerous viruses only spread during major outbreaks or global emergencies. But some of the deadliest infections begin quietly inside ordinary homes, garages, cabins, basements, and storage rooms. You sweep the floor, open an old box, clean a dusty corner, and without realizing it, you may inhale invisible particles carrying a virus that attacks the lungs with frightening speed. This virus is called hantavirus, and although many people have never heard of it, doctors consider it one of the most dangerous respiratory infections because symptoms often begin like a normal flu before suddenly becoming life-threatening. In some cases, healthy adults go from mild fever to severe breathing failure in just a few days. What makes this virus especially dangerous is that early symptoms can look harmless. Fatigue, body aches, headaches, fever, chills, nausea. Most people would never suspect something deadly is developing inside the lungs. But once the infection reaches the pulmonary stage, breathing can become extremely difficult as fluid rapidly builds up inside the lungs. This condition is known as hantavirus pulmonary syndrome, or HPS, and despite being rare, it has a very high fatality rate compared to many other viral infections. Today we are going to explain exactly what hantavirus is, how it spreads, who is most at risk, the early warning signs people often ignore, why doctors take this virus so seriously, and most importantly, how you can reduce your risk and protect yourself and your family. Because many infections happen during everyday activities, cleaning sheds, opening old cabins, working in barns, handling firewood, sweeping rodent droppings, even entering spaces that appeared completely normal. And one important fact surprises many people: hantavirus does not usually spread from casual human contact in most regions. Instead, the main danger comes from infected rodents, especially deer mice and their droppings, urine, or saliva. When contaminated dust becomes airborne, people can unknowingly breathe the virus into their lungs. That is why awareness matters so much, especially for people living in rural areas. Campers, hikers, farmers, cleaners, construction workers, and anyone exposed to rodent activity. Hantavirus is not a brand new virus. Scientists have studied different forms of hantaviruses for decades. These viruses belong to a family carried primarily by rodents. Different regions of the world have different strains, and some types cause kidney disease while others mainly attack the lungs. In North America, the strain most commonly associated with severe lung disease is called Sin Nombre virus. This strain is mainly carried by deer mice, and this is important because infected mice often appear completely healthy. You cannot tell by looking at them whether they carry the virus. That means people may enter contaminated environments without any warning signs. Many infections begin after rodent droppings dry out. As the material becomes disturbed, tiny particles enter the air. If a person inhales those particles, the virus may enter the body through the lungs. This is why experts strongly warn against dry sweeping or vacuuming rodent droppings. Those actions can push contaminated particles into the air very quickly. Instead, health agencies recommend careful disinfecting procedures using gloves, masks, and wet cleaning methods. Another important detail is that people do not need direct contact with rodents to become infected. You do not have to touch a mouse. A contaminated environment alone may create risk. This is why hantavirus cases are sometimes linked to cabins closed for long periods, old garages, storage units, farm buildings, sheds, basements, attics, wood piles, camping sites, and poorly ventilated rooms with rodent activity. Many infections happen after people return to seasonal cabins or begin spring cleaning because rodents may have occupied those spaces during colder months. Now, you may wonder why hantavirus is considered so dangerous compared to other infections. The reason is how aggressively it can affect the lungs. After entering the body, the virus may trigger an intense immune response. Blood vessels in the lungs become leaky. Fluid begins accumulating where oxygen should normally pass into the bloodstream. This makes breathing increasingly difficult, and once severe pulmonary symptoms begin, patients may deteriorate rapidly. In many cases, hospitalization becomes necessary. Some patients require intensive care oxygen support or ventilators. Doctors often describe the disease progression as deceptively fast because the early stage looks similar to common viral illnesses. But then suddenly the lungs become overwhelmed. One challenge is that there is currently no specific antiviral cure approved for hantavirus pulmonary syndrome. Treatment mainly focuses on supportive medical care. The earlier doctors recognize the condition, the better the chances of survival. That is why understanding symptoms early is extremely important. People living in rural regions are generally at greater risk because rodent exposure is more common. Farmers, ranchers, forestry workers, hikers, campers, hunters, and construction workers may encounter contaminated environments more often. But cases have also occurred in suburban homes and ordinary residential settings. Anyone exposed to rodent infestations could potentially face risk. Season also matters. Increased rodent activity during certain times of year may raise exposure opportunities, and climate conditions affecting rodent populations can sometimes influence outbreaks. Another surprising fact is that many people infected with hantavirus were previously healthy adults. This is not simply a disease affecting only older individuals or those with chronic illness. Healthy, strong individuals have also become critically ill. That is why prevention is far more important than fear. Because awareness allows people to reduce exposure dramatically, one of the most dangerous aspects of hantavirus pulmonary syndrome is how ordinary the first symptoms may appear. In the beginning, many people believe they simply caught the flu, or perhaps a seasonal virus. That false sense of security can delay medical attention during the most critical period. The early phase usually begins between 1 and 8 weeks after exposure. But timing varies from person to person. Most patients first notice sudden fatigue and muscle aches, especially in the large muscle groups like the thighs, hips, back, and shoulders. Fever and chills often appear next. Some people also develop headaches, dizziness, nausea, vomiting, or stomach discomfort. And this is where confusion begins because those symptoms overlap with many common illnesses. A person may stay home, rest, drink fluids, and assume everything will improve naturally. But then something changes. The breathing problems begin. Doctors often describe this transition as the cardiopulmonary phase, and it can become extremely serious very quickly. Patients may suddenly develop shortness of breath, chest tightness, rapid breathing, persistent coughing, extreme exhaustion, and a frightening sensation that they cannot get enough air. This happens because fluid begins leaking into the lungs. Oxygen levels start falling, and the body struggles to keep up. Many patients require emergency hospitalization during this stage. Some people deteriorate within only 24 to 48 hours after respiratory symptoms begin. That is why medical professionals emphasize early recognition so strongly. Although cases are relatively rare, the mortality rate is considered very high compared to many respiratory infections. However, survival rates improve significantly when patients receive rapid medical care before respiratory failure becomes severe. Early supportive treatment matters enormously. Researchers have repeatedly identified certain high-risk scenarios: cleaning rodent-infested cabins, entering long-closed buildings, sweeping garages, opening sheds, handling stored equipment, sleeping in poorly ventilated camping areas, cleaning attics, and disturbing rodent nests. The key issue is airborne contamination. Not every mouse carries hantavirus, but infected rodents may shed virus particles in urine droppings and saliva. Once dried, those materials may contaminate dust, and inhalation becomes the main route of infection. Interestingly, ordinary household cleaning habits can accidentally increase danger. Dry sweeping is one example. Vacuuming contaminated droppings may also aerosolize particles into the air. This is why health agencies strongly recommend wet cleaning methods instead. Ventilation is also critical. Opening doors and windows before cleaning enclosed areas may help reduce concentration of airborne particles. Protective equipment such as gloves and masks may further reduce exposure risk. The good news is that hantavirus prevention is absolutely possible. Most infections occur after preventable exposure situations, which means awareness and proper safety habits can make a major difference. The first and most important goal is rodent control. If rodents enter homes, garages, barns, or storage spaces, the risk naturally increases. Preventing infestation reduces exposure opportunities dramatically. Experts recommend sealing holes, gaps, and openings where mice may enter. Even surprisingly small openings can allow rodents inside. Food should also be stored securely. Pet food, bird seed grains, and garbage can attract rodents quickly. Keeping areas clean and reducing nesting materials may help discourage infestations. If you discover rodent droppings or nests, never sweep them dry. Never vacuum contaminated areas. And avoid stirring up dust unnecessarily. Instead, public health agencies recommend ventilating the area first by opening windows and doors for at least 30 minutes if possible. Wear gloves and, if available, an appropriate mask. Use disinfectant solutions and spray droppings, nests, and contaminated surfaces thoroughly until wet. Allow the disinfectant time to work before carefully wiping materials with paper towels or disposable cloths. Dispose of waste safely in sealed bags. After cleaning, remove gloves carefully and wash hands thoroughly with soap and water. This wet cleaning method helps reduce airborne particles, which is the central prevention goal. People working in high-risk occupations may require additional precautions. Construction workers, farmers, wildlife professionals, and pest control workers may use respirators or specialized protective equipment in heavily contaminated environments. Campers and hikers should also remain cautious in rodent-prone areas. Avoid sleeping directly on bare ground near rodent activity. Store food securely, and avoid disturbing rodent nests or droppings in cabins or shelters. If someone develops flu, like symptoms following rodent exposure, especially breathing difficulty, medical attention should be sought immediately. Telling healthcare providers about possible rodent exposure may help doctors consider hantavirus earlier. That information can be extremely valuable during diagnosis. Currently, there is no widely available vaccine approved for hantavirus pulmonary syndrome, and because there is no specific cure, prevention remains the strongest defense. Most people exposed to normal daily environments will never develop hantavirus. The goal is not fear, the goal is awareness and smart prevention. And when people understand the risks, they can take simple, practical actions that dramatically reduce danger. Before we finish, there are several warning signs nobody should ignore after possible rodent exposure. Persistent fever, severe muscle aches, extreme fatigue, sudden breathing difficulty, chest tightness, rapid worsening symptoms, and unexplained respiratory distress, especially after cleaning contaminated spaces or entering rodent-infested buildings. These symptoms deserve immediate medical evaluation because early supportive care can improve survival chances significantly. Viruses like hantavirus often remain invisible until it is too late. But knowledge changes that. Understanding how infections spread, recognizing warning signs early, and following proper cleaning and prevention strategies may protect not only you but also your family and community. Because sometimes the greatest protection begins with awareness long before symptoms ever appear. Stay informed, stay aware, and take care of your health every single day.